we are live. You can start,
Yeah.
doctor.
Hello, all of you. I'm Dr. K. Premila Shekhar, gynecologist at Apollo Cradle, Jubilee Hills, and Apollo Health City. Um, Today, I will be talking about cervical cancer. Cervical cancer is the number one cancer among women in India, and it is the number one killing cancers also. And we have 75,000 deaths every year due to cervical cancer, and every day there are about 200 deaths due to cervical cancer. So it is very important, and it is also preventable, and early detection is possible by screening tests. And cervical cancer is now known to be the result of the viral infection, human papilloma virus infection. Cervical cancer can be detected by doing perpendicular smear, pap smear. As you all know, this is a screening test, and it can be detected by even in early stages. There are many early stages, precancerous lesions, which can be detected and which lead to invasive cancer in 10 years. So early it can be detected. If you treat it, there is 100% cure also. And coming to the cervical cancer, what are the causes of cervical cancer? Mostly it is early onset, like beginning of the early sexual life, multiple sex partners, multi-parity, because number of children, more number of children, lower socioeconomic group, and sexually transmitted diseases. All these are predisposing factors for the cervical cancer. Without all this also, one can get cervical cancer. So everybody has to be careful about the cervical cancer. The, Coming to what is cervix, it is the first part of the womb, which dips into the vagina, and then it is visible by examining doctor, and a test can be taken from it. As I already told, it is the pap smear, and every year the protocol is every year one has to do a pap smear. All women who are married and or who are sexually active, and three normal pap smears. After three normal pap smears, one can go for once in 3 years pap smear up to the age of 65. And then, what are the clinical signs and symptoms? Symptoms with which the woman comes to us. The clinical symptoms are intermenstrual bleeding, uh, then postcoital bleeding, or postcoital discharge, or otherwise also foul smelling discharge. These are all the symptoms with which the woman comes. And on examination, we see that there could be a normal looking cervix also, or there could be erosion, or there could be some growth. And these lesions will bleed on touch. When we take a pap smear, it could be positive for pre-invasive lesions like CIN1, CIN2, CIN3, and or invasive cancer. So we have to do the pap smear, which is a screening test. After the pap smear is confirming, we have to do a colposcopic guided biopsy of cervix, cervical biopsy. That will confirm the cervical cancer. Then we have to go for the treatment. So coming to the treatment, early cancer like early cancer or precancerous lesion, CIN1, it is before the invasive cancer. If you go for surgery or radiotherapy, it is 100% curable. But if you are late, like stages, if there is an invasive cancer and then stage one, there it is divided into stage one, stage two, stage three, and stage four. In stage one, it is 90% 5 year survival rate, and as the stage is increasing, the survival rate decreases. So it is preventable. It can be detected early, and it can be treated with 100% cure rate. So it is very important to be aware of the cervical cancer. As you all know, as I have already told you, cervical cancer is now attributed to the viral infection, like human papilloma virus. We have vaccination for this. We have quadrivalent vaccine and we have got bivalent vaccine. Quadrivalent vaccine is Gardasil, bivalent vaccine is Cervarix. So once you approach doctor, they will tell you the schedule how to take three doses of each. If you take one, it is enough. It is taken by it is advisable for 9 years to 45 years women to take the vaccination, and it is very advisable to take before they get married or before they indulge in sexual activity. And then coming to the treatment of the cervical cancer, it is up to stage 1B. It is both surgery and radiation will give good cure rate of equal cure rate, but radiation has got its own side effects. Surgery is preferable, but since surgery is done, radical hysterectomy is done with lymph node dissection. um, uh, Rare conditions like cervical cancer in pregnancy. If cervical cancer comes in pregnancy, if it is early pregnancy, termination is done and mother is treated. Or if it is near to the term, if there is cervical cancer, delivery is done by elective C-section, upper segment C-section, and then the surgery is done. And then in advanced stages like 3 and 4 stages, which is spread to the other parts of the local and distant, the chemotherapy and radiotherapy are recommended. And then anyway, it is curable and then early detectable cancers. So we have to have annual checkups and then go to the doctor as soon as the symptoms arise and go for the best treatment. Thank you. Yeah. How can we prevent cervical cancer from occurring? We all know now that the 99% of the cervical cancer is because of the viral infection. We can prevent it by taking the vaccination before the marriage or before getting into sexual activity. So that way we can prevent, and we can also prevent an invasive cancer by doing an early examination and treatment. Will consuming contraceptive regularly lead to? Yeah, in few cases, even contraceptive take for a long time, prolonged time can lead to cervical cancer. It's also one of the causes. Even by wearing like barrier contraception, also you can prevent cervical cancer. Regularly wearing barrier cancer contraceptive. Can can I have cervical cancer post menopause? Yeah, the mean age of cervical cancer is 48 years, but it can occur anytime between 35 to 65 years. And postmenopausal bleeding also is one of the symptoms where there can be cervical cancer. In any symptoms, you have to go for the pap smear. If during pregnancy we detect cervical cancer, will it be genetically transmitted? It is not genetically transmitted to the baby. How often should we get full body checkup? Once annual, um, every year, pap smear, especially for cervical cancer, appendicular smear, pap smear is advised every year. After 3 normal pap smears, there is no need to do every year. You can do once in 3 years pap smear. And as I said, as and when there is a problem, you can consult the doctor for further management. If if I am a cancer survivor. Can I have a body get pregnant post that have a baby get? Yeah, if the cervix is intact, only minimal surgery is done, colonization is done. It's an early cancer, like up to carcinoma in situ and less than that. One can become pregnant and have a baby also. What is the other question? Doctor. Thank you very much for patient hearing.